Hi, my name's Andrew. I'm going to be going over your initial assessment. This is something that you guys will be doing when you're admitting a patient here to St. Vincent's. Also, with that comes with the medication reconciliation. You are already familiar with the screen of your patient desktop. On the left-hand side, you're going to click on the tab that says Work List. That's actually a shortcut. Your work list is something that needs to get done on your shift according to the time. You're going to see something at the top that says Interdisciplinary Initial Assessment. This will populate when the patient is admitted to your unit. You're going to double click on that like I did. Read the transaction line at the bottom. It says, what do you want to do? We want to document, so I will click on document. And it says, what time do you want to document? I'm going to document now. For example, if the patient came at 9 o'clock in the morning, it's now 11 a.m., and you need to backtrack the time. It's okay to change the time. You can just type in 0900, but for now, for training purposes, I'm just going to hit the Now button. I'll press OK. It's telling me that the time is not being resulted at a normal time. We understand that because this is a test environment. On your computer screens, when you document, this will not appear. Our first thing, it says chief complaint. So this is why the patient came into the hospital. If you read the transaction line at the bottom, it says enter chief complaint / reason for admission. We're going to say that the chief complaint is abdominal pain times 3 days. I'm going to press OK. The next screen, it says document a present illness history. So I'm going to click on that. It's going to say the onset. So I'll put 3 days ago. I'll press OK. The next is description. So it's going to ask me, describe this. We're going to say that the patient complained of aching pain. Press OK. We'll do that one more time. Now, if you notice at the bottom, it says document illness, disease history, or no past disease history. If the patient has a history of hypertension, diabetes, and etc., you can document that now. For training purposes, we're going to say that there is no history. So I'll click on that. It's asking me if the patient has any surgical history. If the patient did have surgical history, you would document here by pressing the D. If the patient has no surgical history, you can press N or click on this icon here. The next thing it took me to was injury history. If the patient had any injuries, we're going to say no for training purposes. The next line says, does the patient allow blood products? If you read the transaction line at the bottom, it'll say you can type in Y for yes, N for no, or U for unable to assess. We're going to say yes if the patient does. Does the patient have a history of previous blood transfusions? We're going to say no for now. If their physician wanted to be contacted, you can put in the phone number here. We're going to assume that it's no, so we're going to click no. Before I do that, you'll notice that there's a lot of topics or areas that have the bold print. Anything that is bold is mandatory and must be filled out. Anything that you see that is not bolded is not mandatory, but we do request that you do fill that out. Okay, after I selected everything here, I'll press OK. And you'll notice at the right hand side of the screen where it says past medical history, the no data incomplete line has fallen off, and you have all of these rest to do for your admission. The next line that we're going to click on is the health history. This is where we're going to document our medications that the patient takes home, which is also known as our medication reconciliation. You'll notice that aspirin already has been documented here. We're going to document another medication to show you what it looks like. So this patient already has taken aspirin at home, probably from a previous admission. If we're going to add another medication, we're going to press the Add button on the bottom. And then you'll notice at the bottom it says Enter partial medication name or choose an option. So we're going to say that the patient also takes vitamin C. If I press the dash line, it's going to find anything associated with vitamin C. This is the vitamin C that I want, which is number 1. So I'm going to double click on that. It's going to ask me the milligram dosage, the tab dosages, and so forth. What I'm going to do, I'm going to click on number 1, milligram. It says how many milligrams does the patient take. We're going to say it's a 500 milligram dose. We'll click on OK. And the patient stated that they take it just once a day, so we're going to click here on number 7. Press OK. How does that medication come? Well, we're going to say that it's a 500 milligram tablet, which is the most common. Press OK. The reason why the patient takes this. So you have to ask the patient why they're taking this, and they said that they're taking it as a supplement, so that's what we'll type in. We'll press OK. This is where you're going to type in the doctor who ordered that medication, or leave it blank if the patient decided to take this medication on their own. I'm just going to click on the doctor's name here just so we can show you how it looks when it adds. The date and time last taken. So we're going to say the patient took it today. So as a shortcut, I'm going to press T for today and press OK. And you'll notice that the date popped up here. The start date. This is when the patient started taking the medication. They don't know when they started taking it, so we're going to leave it blank and press OK. Stop date. They don't have a stop date because they took one today this morning, so we're going to just leave that blank and press OK. The next tab asks you, who gave you this information? We're going to click on number 3 as the patient did and press OK. The next section here asks, what did we do with that medication? Did we give it back to the family to take home? Is it at their bedside? Well, the patient actually just verbalized it and told us this, so we're going to skip this section because it's not an option here. At the bottom it says, does the patient request to take their own medication? We're going to say no. And if I want to enter any comments, this is where you would want to do that. I don't want to, so I'm going to press OK. If the patient stopped taking a medication because of a specific reason, you would choose one of those here. There's no reason why they stopped taking it, so we're going to just click OK for now. Press OK one more time to get to the next screen. So you'll notice now the patient has 2 medications on their medication reconciliation. So we're going to assume that these are the only 2 medications the patient takes at home. So we're not going to add anything else. However, if the patient does take more medications at home, you would add another line and keep adding the medications accordingly. And press accept at the bottom. Our next section, you'll click on latex precautions. So at the bottom transaction line, it asks us, latex precautions initiated. We're going to say no because we're assuming that the patient does not have any allergies to latex. You'll press OK. The next line is advanced directives. You'll click on that box there. It asks you, document advanced directives or unable to determine. Right now we're going to say we're unable. The next line, click on substance abuse. It asks you, does a patient has any alcohol intake options? We're going to say none for now, just for training purposes. Tobacco history, we're going to say the patient never smoked, number 4. Any drugs, we're going to say no or never used, number 1. Then click OK. We're going to press OK one more time. Now it's going to take you to the influenza season. So it's not influenza season now because at the bottom it says we only do this during October and March. We're actually in the month of May. So I'm going to select no. Pneumonia screening. Click on the box and it's going to give you the inclusions criteria. So this is why the patient can have the pneumonia vaccine. We're going to say that there's no inclusion criteria identified for now. If there was, you can select one of these here. So I'll click on that, press OK. Now this is an exclusion criteria category. This is why we would not give that vaccine. And we're going to say, just for documentation purposes or training purposes, we're going to say that the patient refuses, number 8. Click OK. Click OK one more time. If you filled out everything here and everything looks okay, you can press OK, or you can go back and edit. We're just going to press OK for now. And you'll notice that has fallen off of our list. So our next thing that we have to document is our cognitive neuro assessment. You'll double click on that. So you'll click on the number 1 line. It asks you, is it within normal limits? We're going to say yes. If I click on that, you'll notice that everything has pre-selected, pre-answered the questions for you. If there is a problem with vision or pupils, you can click on that area and change those accordingly. I'm going to press OK, and that has fallen off of our list. Our next section is ENT assessment. We're assuming that there's nothing wrong with the ENT, so we're going to click on accept and no exceptions and press OK. Click OK again if there's no other edits needed to be made. That's fallen off of our list. We'll go to cardiovascular. We'll say that there's no problems here. So once again, click on this box, click no exceptions, and then you'll press OK. Does the patient have a pacemaker? You got to click on that box, answer yes or no. We're going to say none. Press OK. So you'll notice with the system that it kind of guides you and tells you what to do. Next section, number 6, respiratory assessment. We're going to assume that there's nothing problem with the respiratory because he only came in with bowel troubles. So we're going to press number 1, no exceptions. Okay, is the patient on oxygen therapy? We can select just room air. Now if you did notice something was wrong with the patient's lungs, this is where you can document it and change what has been pre-selected. Next section, GI/GU. Is it within normal limits? We're going to say no. Okay. We're going to collect. Let's say it's within normal limits for now, and we're going to change make a problem. Let's say that the last bowel movement was, say, 5 days ago. So we're going to put T, which is today, minus 5, which is today minus 5 days. Press enter. Oh, apologize for that. Click on number 1. That was a trick that we could use with documentation, but in this field that doesn't allow you to do it. So it's going to ask you enter date of last bowel movement. So we're going to type in the date. Okay, so we put that bowel movement for 3 days ago. Okay. Pregnancy status, you'll click on that box. Obviously, patient's not pregnant. Is the patient lactating? We'll say no, not lactating. And you'll notice that what's being completed here or documented is everything in bolded. Okay. You'll press OK. And you'll notice that it says incomplete. That means I left something off. So I need to go back and fill something out. Okay. If I scroll down to the bottom, I left a GYN problem. So I'll click in here. I'll say there's no problem or none identified. Click OK. And so forth. Musculoskeletal, we'll say that there's no problem there. Press OK. Nursing. Has the patient recently lost more than 10 pounds without training? We're going to say no. His intake has been reduced? We're going to say no. Tube feeding? No. TPN? No. Wounds? No. And so forth. Then you can press OK. So this is your admission assessment. What you'll do is you'll keep clicking on each assessment category and keep completing them as required. When you get to the last psychosocial assessment, you'll complete that as well too. Everything on the right hand side will be blank, meaning that it's been completed. At the bottom left of your screen it will say accept. Once you accept that, it will fall off of your work list, and that is your initial assessment.